Hi everyone, today I'm going to be going through a few example genetic test reports that were provided by the Families SCN2A Foundation to discuss and show you how to read the report as well as find relevant information about the change that has been found in you or your child. I want to make a note that I'm going to be going through an example of whole exome sequencing, and while changes in SCN2A may have been found on a different type of genetic test, like a microarray or a panel, I am not going to be going through examples of those reports, and this is specific to a whole exome sequencing report. The example report I'm going to go through today is from a laboratory called GeneDx. But if you had exome sequencing performed at a different laboratory, it will look somewhat similar and will contain the same information. So at the top of the report will be the person's name who got the testing done, as well as the provider who ordered the testing. And as we move down, we'll see that this was a whole exome sequencing analysis as noted under test requested. Clinical indication is something that the ordering provider has to note because exome sequencing uses a patient's phenotype or clinical presentation to help interpret the results. So this indication just lists some things that the provider might have listed when they ordered the testing. Based on these clinical indications, then, a laboratory can decide if a test was positive, negative, or inconclusive. And so on this test result, we can see that it was positive, meaning that they did find a change that explains the clinical indication that the provider had listed. The information about this variant will be found in the box a little bit further down on the report, and this is what it will look like. A few important things are going to be listed in this box. We are going to have the gene that was found, the associated disease, the mode of inheritance, the variant that was found, the zygosity, inherited from, and classification. And I'm going to go through what all of those mean. The gene refers to in what gene the change was found, and in this case, it was SCN2A. Disease is the associated disease with a gene. So for this gene, it is SCN2A related epilepsy. Mode of inheritance refers to what type of change needs to happen to cause disease. SCN2A is inherited in an autosomal dominant fashion, meaning that receiving one copy of SCN2A that has a change would lead to disease. Variant lists the C dot and P dot, which we talked about in our previous video. So talking about the specific change that happened at a DNA level and a protein level. Zygosity refers to if there is one or two copies of this change. So heterozygous means that there is one copy of this change. Homozygous would mean that there are two copies of this change. Inherited from would list if it is inherited from mom, so maternal, or dad, paternal, or de novo, meaning it wasn't found in mom or dad. Typically, when we do whole exome sequencing, we also take DNA samples from mom and dad to compare and see if these changes were inherited. In this case, this SCN2A change was de novo, meaning it was new in the child. The classification is important because a variant that is classified as likely pathogenic or pathogenic means that it would likely cause disease. The interpretation below the graph just explains that they believe that this variant is consistent with the reported phenotype or presentation that the provider listed, meaning that they think that this is causing the presentation. Underneath of this are recommendations, and GeneDx always lists these three things on their reports. My favorite is to speak with a genetic counselor. If you have any questions about speaking with a genetic counselor, please reach out to the team at Families SCN2A, as they have wonderful resources and can provide you to some excellent providers. If we go to the second page of the report, we will see a gene summary that talks about SCN2A and its role in our body, as well as the spectrum of disorders that can occur when there is a change in this gene. I am going to go into some specifics in a future video, but it's important to note that this summary is the same for every patient who has a change in SCN2A when reported by GeneDx. And so when we think about the idea of knowing what your specific change is, that is why seeing a genetic counselor is so important, because they will be able to hopefully figure out what type of variant your child's or your variant is, whether that be a gain of function, a loss of function, or a mixture of both. If we go down to the last sentence on the page, we can see that the proband's mother, meaning the patient's mom and dad, did not harbor the change in the gene, which is exactly what we had seen previously, saying that it was new in the child.